Today on COVID-19 Local Impact, new ways of doing business for local restaurants.
Sometimes we get backed into a corner when we hit a challenge and we come out fighting and we find new ways of doing business and we find different methods of trying to reach people.
Men's mental health, overcoming the stigma.
We weren't taught how to put a voice to our pain. It wasn't really modeled for us.
Major Series Lacrosse, will we see a season this year?
The league has mentioned July 1st as a more realistic start date.
And discussions around reopening the city.
Talking about what it might look like, but it is, I think, still a little bit premature.
Hello and welcome to COVID-19 Local Impact on Your TV. I'm Dan Malta from the Your TV Peterborough studios. A slight increase in local numbers as we'll now take a look at the COVID-19 stats from the region. In the city and county of Peterborough, Hiawatha, and Curve Lake First Nations, 58 confirmed positive cases, 1,515 confirmed negative with 360 currently under investigation, 1 death, and 32 resolved cases. In the city of Kawartha Lakes, 114 confirmed cases, 7 hospitalizations, 33 confirmed deaths as part of the 2 confirmed outbreaks, and in Northumberland County, 13 confirmed cases with 1 hospitalization. The month of March may have seemed like the year of March, yet the end of April is almost here. Peterborough Mayor Diane Therrien says the city is starting to discuss what services might return to a somewhat normal state once the pandemic eases.
It's interesting because the first couple weeks back in March, everything was like these decisions being made on the fly. What are we doing? What's closed? What's open? How do we run these? And now we're in a position where we kind of know what's running, how it's running. Certainly we're trying to make improvements if there are areas for improvements. And we have started to kind of look towards like the light at the end of the tunnel, but not knowing when that tunnel is going to end. So the discussions around what things are going to look like as we come out on the other side are really only just beginning because, again, we don't have a date. We don't know. And I've talked to colleagues across the province that are in the same, nobody knows. We're all in the same boat. So, talking about what it might look like, but it is, I think, still a little bit premature to try to figure out when. I know that a lot of the organizations that I, work with or, some of the post-secondary places are planning for multiple scenarios. What happens if it's this date, or this date? And what do those things look like? So at the city, we're doing that as well.
What are you doing for dinner tonight? Local resident Wade Hamblin started a Facebook group called PTBO Food to Go during COVID-19 because a colleague of his was doing the same in Wichita, Kansas, and he thought it would be a good idea for Peterborough. The goal is to connect people with restaurants in the area that are still open for business during the pandemic. The Facebook group started on March 25th and just last Friday hit 1,000 members. Your TV's Mary Tendeshat speaks with Hamblin, who says the response has been wonderful.
I didn't expect such a positive reaction. I just did an interview with Kyoto Coffee out near Lakefield, and I bet you there's been 10 people text me privately on my phone that has said, I've never heard of this place and I can't wait to go try it. And so I'm like, okay, we're on to something, right?
Are all the businesses able to keep up with the demand that I'm sure the traffic from your website is generating?
I think some of them have felt a big hit with this pandemic that we're in the middle of. And so establishments are posting their own menus and their own specials for the day or the week. And then we're finding people are, once they hit one of these restaurants and they get it delivered, they're taking pictures of their family and the food and they're posting them on there. And I think the biggest thing is I don't want to just get through what we're in the middle of. I want to be better on the other side than I am going in. And so I find that especially with entrepreneurs or businesses and local restaurants and myself, sometimes we get backed into a corner when we hit a challenge and we come out fighting and we find new ways of doing business and we find different methods of trying to reach people. And so maybe this is one of them. Maybe this continues beyond our the situation that we're in the middle of. So I'm excited for what's happening, and I'm excited to see what comes outside of this pandemic and when we get to the other side of it.
Mental health is an issue on the front burner as everyone's life is impacted by the COVID-19 pandemic. Chris Potter from the Mental Health Podcast speaks with mental wellness advocate Alan Keller about men's mental health.
Today we are talking with Alan Keller. He's in Saskatchewan, and he's a national speaker, best-selling author, and an advocate for men's mental health. His newest book is called Mental Health, It's Time to Talk. And I think more now than ever, it is definitely time to start talking about mental health. And it's everybody. I know you have a focus on men's mental health. And interestingly, in the news this morning, I saw a piece, a 35% increase in prescriptions being written for anxiety medication. But the number that really blew me away was twice as many women over men are getting those prescriptions. And it's not that there are less men in need, it's that there are less men willing to ask for help or to talk about the problem. And I think that's really what you have focused a lot of your time and effort on. And let's dig into that. Why do you think men are so unwilling to talk about this as a problem?
I think that historically, when we look at the way in which a lot of us were raised as boys, we weren't taught to be with our emotions. We weren't taught how to put a voice to our pain. It wasn't really modeled for us. It was more that idea of manning up, keep your head down, and that it's perceived as this weakness to ask for strength. And I think that we're definitely seeing a shift. And I know for myself, it really required being vulnerable and taking a risk. And what I found surprising for myself and also the men in which I interviewed was the fact that once they were able to be vulnerable and put a voice to some of their pain, what they thought was going to happen, such as being judged or perceived as lesser than, as weak, never happened. It was the opposite. They were always met with support. And so I think as the more that we're able to see the outcome and to see that, hey, as men, it's all right, it'll give other people permission to do the same.
Personally, I'm finding the struggle harder and harder. And I have weekly counseling. I have a psychiatrist I speak to on a regular basis. I am on my medication and I don't miss my meds. I don't. So how do we get somebody who is struggling today that doesn't even think that they should talk about it? How do we help that person that's hearing this or seeing this? How do we get them to take that very first step? That incredibly difficult very first step in coming to the realization that this is something that needs to be dealt with. It can't wait. And I think that's probably the most important thing is people think, oh, I'll deal with this later, or I'll be better in a couple of days, or this will just blow over when the pandemic's over, I'll be fine.
Right. Yeah, well, I think number one, Chris, is to break through the denial. If you think that there's a problem, there probably is. So it's to stop projecting, it's to stop pointing. And the challenge is that we live in a world of doing. You ask people, how are you doing? Oh, I'm so busy. What has happened now with COVID-19 is all of a sudden we cannot be as busy as we once were. So all of a sudden we're stuck with this. We're stuck with this.
Right.
I don't know about you, but I hated being stuck with my thoughts. And so I think in order to break through the denial, you have to take an honest look at self and start having a relationship with self, which was incredibly difficult. And then just giving yourself permission to reach out for help, to be a little vulnerable and just test the waters. Test it with a close friend, somebody that you feel safe confiding in. It doesn't have to be a trained professional. And I suspect that what will happen is that there will be relief, because emotions are energy. And it's the same thing. I'm sure you can experience this or have experienced this when you had a rough day, you're stressed, you're frustrated, and you just share with somebody that you trust for 10 minutes. And all that you do is talk, and they just listen. And at the end of those 10 minutes, you sit back and you think, I feel better. Why? Because you were able to get some of that darkness out. So I would say test the waters, see what happens.
That makes perfect sense. And it addresses both those that are struggling and aren't sure what to do, and those that are seeing others struggle and aren't sure what to do. And on that, I want to thank Alan for your time today. It's great to connect with you, and I look forward to speaking again. For Your TV, I'm Chris Potter.
Thanks for that, Chris. Nova Scotia is mourning the loss of 19 individuals and a 23-year veteran of the RCMP. Cobourg Police Chief Paul Graaff took time during his interview with Your TV's Mark Rockburn to pass along his condolences to the entire community.
These are never easy times for men and women in law enforcement across the country, if not across the continent. When another member of any police service is killed in the line of duty, it sort of brings home the volatility and the inherent danger of all of our work. But our deepest condolences from the Cobourg Police Service family go out to the RCMP in Nova Scotia, specifically that of Constable Heidi Stevenson and her family. I know that she is a mother of younger children, and that is just yet another tragedy. So our heart goes out to them. Normally in these tragic circumstances, there is a time to heal as a group, and that being that police funeral or that regimental funeral in the case of the RCMP. During COVID, I don't imagine we were going to have such a thing. So for a lot of police officers across the country, there's going to be some issues with closure. So my condolences do go out to that family, and I ask all of our members across the province, across the country, to reach out to support wherever they can get it in this time of need.
Paul, I know you weren't here when Chris Garrett was tragically killed in Cobourg, but as a frontline police officer and now in the administration side, what does it mean to the force and to the family when the forces are able to get together and truly honor the individual that had been killed?
Yeah, I don't know what it means for the family because I've not sat in their shoes, so I can imagine what it would feel like. But for the policing family, it's an opportunity to come together and just recognize that you're not alone. A lot of times we're becoming far more aware these days of the mental health issues that strike police officers across our country. And it's that feeling of isolation. So that opportunity to come together as a group, to come together in one like industry, it puts all of the other issues that are bothering us day to day in the back burners where they belong typically, and gives us a chance to support each other. So this may be a hole, but I'm sure the RCMP will figure out a way to do that in some manner or form. But again, as I encourage all members of police services across the country to reach out to your local support, your peer support, your family, or your agency for support should you need it.
At the Northumberland County Council meeting on Wednesday, April 15th, Council received an update from senior staff on the economic impact of COVID-19.
We had a preliminary, update on both, where the revenues are being decreased, and I think that will have an economic impact. Certainly, having no bag tags. I guess the good part of this is that the federal government has, and the provincial government has provided funds to the county to offset some of the immediate requirements. County is very, engaged in social activities and social support networks, and I think that's certainly where we would be having a significant outcome, in a negative way. Hopefully that's going to be balanced out, but the day-to-day activities, are significant. Probably in the range of 200 to 259,000 per month, ongoing. I don't know whether we will have to address that from a reserve perspective, or whether we'll be able to make up some of that lost ground. We certainly understand and agree that there are delays. Delays will also add costs, whether it be the Golden Plow. The impact on staffing, it's obviously being reduced to some degree as well, and there are both costs and savings. So we got a fairly good overview department by department. It is on our website for people who'd like to get that detail, but I also emphasize that it's an interim report. It's not a final. It gives us a very good indication that we're going to have to tighten the belt a little bit, and that again it just can't come out all of a sudden from the taxpayer dollars. Everybody's in trouble here.
Did anything really stick out to you when you first saw the report?
Just certainly the waste and management area. I think that's extremely significant. That's, as I say, it's about $250,000 a month just in that area. All the other areas were sort of, from a perspective, a little bit less. Deferred taxes will cost some money. The interest rates, are going to be diminished, as you know. So, but none of them are huge, other than I think the waste collection is probably the largest. Where we're going to get into it a bit, I think, is when it comes into the employees. Obviously, looking after our employees and looking after people generally is a significant part of our structure. So that'll be having some financial impact. Some workers want to be laid off. Some people feel they're at risk. I would like to mention to some degree, because there's a lot of discussion about long-term care, and I can assure you that from a long-term care perspective, the Golden Plough is as aggressive as any other kind of long-term care facility. They're doing a really good job, and the workers there, I think, need to be applauded.
Has there been any layoffs as of yet at the county level, Bob?
Yeah, only in the same area where there's a redundant need, mostly in a part-time area. And I think now that we have another 4 weeks, the discussions will be, how deep is that going to go? How effective are people working at home? Because it's very clear, I think, to council anyway, and I think to the public, that the public employee at any level should not be immune to this whole system. We're all in this together. And I've heard comments about the fact, well, it's all right to be working for the county or the municipality because your job is protected. That's just not true. It's got to be part of our process as well, same as any other significant employer, because that's what we are. We're a corporation. We're an employer. Our staff has to be effective. The essential services are still running. We're getting lots of emails, lots of responses, but there are some things that we really can't proceed with.
As COVID-19 local impact continues on your TV, a University of Waterloo team is making a push for a COVID-19 vaccine. Hello and welcome back to COVID-19 Local Impact on your TV. I'm Dan Malta. From Cogeco News in North Bay, anchor Greg Estabrook speaks with a University of Waterloo associate professor who's part of a team working towards a COVID-19 vaccine.
A lot of my background is in genetics and microbiology, so it's a little bit of an area that's familiar to me. And you know what's out there, and we have a good sense of what the available scenarios are, and we just lend to what are the internal capabilities of what we believe that we can do best, and how we can design something that draws on a lot of the literature and what's been done, and figures out how can we novelly do something that we believe is better, more durable, and more universal across the board as well.
You're not the only group trying to develop a vaccine, as you're well aware. Are you in any contact with any other scientists in other cities or other countries who are embarking on this?
Yes, I mean, there's a lot of contact, and a lot of this happens just by virtue of literature and a lot of sort of, pieces that go out, learning from others. Anytime, this is what's really cool, and what I'm really thrilled about seeing in Canada, it's not a matter of, a race of who gets to it first. It's a matter of getting this done and finding a solution as fast as possible, and seeing all the other investigators across the country rising up and taking action against this. That's the way it should be, and it's a cool thing to see. It's the way it's a great thing to see. So yes, this is a collaborative effort nationally, is the way I see it.
There has been some progress. You're getting some good early results. How are you getting those results, the positive ones?
Well, this is all based on a platform that we had derived. I have two different companies that have spun out of my lab based on some of our previous research. We're DNA specialists, so Metaphage Bioceuticals is one of those companies that has a new approach and a new vector that can be a very safe and effective way of being able to deliver DNA. So we drew on what those capabilities were, as well as a new delivery vector that is highly novel using a bacteriophage through another company, Theraphage. And putting those together, it just made a significant platform that we believe can just draw on all the necessary immunological pieces to do something not only different, but more effective than what has been done previously.
Dr. Slavtsev, there's also been a lot of I guess, concern, worry about timeframes, development timeframes. Some people say it takes years to develop a vaccine. Some say it could take as little as a year. Can you put a clock on it, or is that too difficult?
It is difficult. I mean, everything's really based on the necessary testing. To alleviate some of those fears, I think the best way to look at it is that a lot of the regulatory hurdles that are in place, although expedited at present to be able to get something into the hands of people who need it, they're necessary. And having these safety measures in place is a very important part to make sure that no matter what is developed and by whom, that it is appropriately tested in all the various and right areas to ensure that it is a safe vaccine for any further usage. So that does add time, of course, but it is important.
Monday's Fill the Bus food drive was a huge success. The four Kawartha Lakes volunteers were Sarah Williams, Helen Hawkins, Daniel Mann, and Kathy Chamberlain, who collected more than 1,000 pounds of food and more than $460 in cash donations for the Kawartha Lakes food source. Good for them and great for the city of Kawartha Lakes. The Peterborough Examiner published an article regarding the Major Series lacrosse season. Your TV's lacrosse analyst Scott Arnold explains what the comments from MSL Commissioner Doug Louie mean for Peterborough lacrosse.
The Major Series lacrosse season is just over a month away, with the Peterborough Lakers home opener penciled in for June 4th. But with the arena shut down until at least May 31st, it looks like that date will likely be pushed back. Now, the league has mentioned July 1st as a more realistic start date with a reduced 10-game schedule. What that would mean is that all 6 teams would play each other once at home and once on the road, with playoffs starting in August and the Mann Cup slated for September. At this point, though, everything is still up in the air and there's still so many questions left to be answered. Will the arenas reopen on time to squeeze in a season? Will the players be in game shape and ready to return? Will fans want to come out to a crowded arena? Will businesses have enough money to sponsor teams and keep the league afloat? So many questions, but unfortunately, nobody knows when we'll have any answers.
Thank you very much for that, Scotty. And it is National Volunteer Week, and as we did yesterday, we'll be highlighting a volunteer here at Your TV. Today's volunteer, Paul Rellinger. Let's hear what Paul Rellinger is up to during the COVID-19 pandemic.
Hi, I'm Paul Rellinger, the host of Peterborough Matters, and like many of you, have been housebound for the last couple of weeks. Missing sitting in every couple of weeks with Mayor Diane Therrien, but we'll be back at it before you know it, in some form, I'm sure. Surviving during COVID-19 at home. I'm sure everybody has their own stories. I brought some props. I have my Kobo, which is very handy to have, especially now. I have my PS4 games. So we've got hockey, we've got golf, I got baseball, NBA, and of course, I also have Netflix, which I know is kind of a go-to for a lot of folks right now during COVID. I hadn't seen Ozark, and I was so excited to see it, and I just never had the time, and so I've been able to catch up. But I do hope you and yours are staying safe and certainly practicing physical distancing. Continue to do that. As of this taping here right now, the spread is slowing, but we need to stay at it in order to get past this. So do stay safe, you and yours, and we'll catch you soon on Peterborough Matters.
Haliburton Kawartha Lakes Brock MP Jamie Schmale worked as a radio journalist before politics. He's now launched a new podcast.
It's available through my Facebook account, Twitter, also Castbox, Spotify, iTunes, Google Play, a wide variety of platforms where people can download or listen to that information. And yes, during this crisis, it's been more focused on informing and talking about some of the issues that individuals, businesses, operators are facing and how we're getting through it. And not only that, offering suggestions or discussing possible solutions or tweaks to programs that are currently out there that might be able to better take care and look after people during this uncertain time. So it's normally every Tuesday at 1:30 p.m. Eastern time. Now it's Tuesday and Thursday at the same time, and just talking about various issues and top of mind problems that might need to have a firm discussion on.
So, as always, low taxes, less government, more freedom. That's the blueprint.
As we wrap up today's show, we'll take you to Northumberland, where the Northumberland Agricultural Society paid tribute to frontline workers in the region. For your TV, I'm Dan Malta, and we'll see you tomorrow.